Study section 16. Role and responsibility of the midwife in prenatal care. Introduction. The midwife works in partnership with women to give the necessary support and care and advice during pregnancy, labor, conduct births, and care for mother and child postnatal. In this study section, you will be learning about the midwife's role in prenatally. Learning outcomes. At the end of this study section, you should be able to 1. Define the meaning of the word midwife, explain her role. 2. Discuss the specific prenatal responsibility, meaning of midwife, and her role prenatally. The midwife is a person who, having been regularly admitted into an accredited midwifery educational program in the country which it is located, has successfully completed the prescribed course of studies and has met the requirements to be legally licensed to practice midwifery. WHO. The midwife's role. A practicing midwife is responsible for providing midwifery care in accordance with such standards as the council may specify from time to time to a woman and her baby during the antenatal, intranatal, and postnatal periods. The care includes antenatal education, preparation for parenthood, the promotion of normal birth, the detection of complications in the mother and the fetus. Specific prenatal responsibility. Prenatal responsibility is the care on expectant mother received from healthcare professionals, which include educational supervision and treatments given to the pregnant women from the time of conception until the beginning of labor in order to ensure safe pregnancy, labor and puerperium. The midwife's role. A practicing midwife is responsible for providing midwifery care in accordance with such standards as the council may specify from time to time to a woman and her baby during the antenatal, intranatal, and postnatal periods. The care includes antenatal education, preparation for parenthood, the promotion of normal birth, the detection of complication in the mother and the fetus. The midwife's role. Health promotion and counseling, examination, general and obstetrics, screening tests, syphilis, HIV, urinalysis, and blood treatments as appropriate, preventive measures, tetanus, tozoid, and hemotinic. 1. Health promotion and educational counseling. Inform and educate the women with health messages and counseling appropriate to individuals, needs, concerns, circumstances, gestational age, most prevalent health issues. Support the woman in making decisions and solving actual or anticipated problems. Involve partner and family in supporting and adopting healthy practices. Health educates clients on the following. Malaria control in pregnancy through the use of intermittent preventive treatment (IPT), use of insecticide, treated nets (ITS), and other methods of environmental sanitation practices to eliminate breeding sites for mosquitoes and personal protections. Diet and nutrition. 1. Advice on balanced diets, prevention and treatment of anemia. 2. Care of common discomforts. Use only prescribed drugs. Avoid use of potentially harmful substances, e.g., herbs, unprescribed drugs. Advice on tobacco, and cigarette smoking and effects of alcohol intake, infection prevention hygiene, and washing before preparing food, eating and drinking. Hygiene, personal and environment, e.g., use safe drinking water, handle and store food safely, practice good dental hygiene. Rest and activity, tell clients to decrease the amount of heavy work and increase the rest time. Avoid lying on back late in pregnancy to prevent decreased blood supply to the placenta site. Lie on side. Maintain good body posture and avoid overexertion. Sexual relations and safer sex. Reassure clients that sexual intercourse will not harm the fetus. Have sexual relationships with only one partner who is free from HIV and STIs. Practice and abstinence if desirable. For those at risk of STIs and HIV, use condoms correctly and consistently. Importance of delivery by skilled attendants, birth or delivery preparedness. Early and exclusive breastfeeding and immunization, HIV/AIDS prevention and care, and role at VCT and MTCT, prevention of other endemic disease or deficiencies, e.g., hookworm infestation. 1. Prevention of complications of pregnancy and childbirth. 2. Early detection and treatment of existing complications and problems such as malaria, severe anemia by physical examination and testing. Pre-eclampsia through measurement of blood pressure. HIV through voluntary counseling and testing, and prevention of MTCT. Sexual transmissible infections including syphilis testing. Screening for tuberculosis. 3. Birth planning or preparedness and complication readiness. The purpose is to develop birth plan, the exact plan for normal birth of the baby, and establishing a financial plan or scheme. Recognition of danger signs. Vaginal bleeding, difficulty in bleeding, severe abdominal pain, severe headache or blurred vision, fit convulsion, loss of consciousness, labor pains before 37 weeks, swelling of the face, hands and legs, decreased or absent fetal movements. Nutrition. Educate on balanced diet. Food to avoid includes coffee, alcohol because of their effect on the fetus. Emphasize at least one extra serving of staple food per day. Eating adequate diet that contains beans, nuts, starchy foods, animal products, fruits and vegetables, as well as foods rich in vitamins and minerals. Demystification of food taboos. Give vitamin A. Supplements. Take 2. Supplements where sufficiency is endemic. Give 10,000 IU vitamin A daily or 25,000 IU weekly during the second and third trimester. The dose should never exceed 25,000 IU and should not be given during the first 60 days of pregnancy. Give iron and folate, at least 60 mg, iron plus 400 mcg of folate by mouth daily throughout pregnancy and for 3 months postpartum. Be encouraged to eat foods rich in iron, e.g. green leafy vegetables, and vitamin C, e.g. fruits, which aids iron absorption, and avoid drinks such as tea and caffeine, which may inhibit iron absorption. How to calculate expected day of delivery, EDD. For a normal 28 days of cycle, add 7 days and 9 months to the first day of the last menstrual cycle. Example, if last menstrual period is 15th January 2009, the expected day of delivery EDD will be 22nd October 2009. Or add 7 days to the last day of the last menstrual cycle period and subtract 3 months. From the months of the last menstrual period, LMP, i.e., if LMP is 15 January 2009, EDD will be 15th plus 7 days, 22nd of minus January, December and November, October 2009, i.e., EDD will be 22/10/2009. Take history of presence of any ill health, such as swelling of the limb, excessive weight gain, raised or rising blood pressure, proteinuria, excessive vomiting, excessive vaginal discharges, fever, dizziness, vaginal bleeding, unusual tiredness or breathlessness. If any two of the first 4 features are present, then the woman is prone to hypertensive complication in this pregnancy. Study section summary. In this study section, you have learned that 1. A midwife is a professional who has successfully completed a course of study in midwifery education and is legally licensed to practice. Our role, our responsibility include caring for clients prenatally, intranatally, and postnatally. 2. Specifically, the midwife prenatally ensure good outcome of pregnancy, labor, and puerperium by health promotions, counseling, prevention of complication, early detection, and prompt management of existing problems, and birth preparedness and emergency readiness. End of study section 16. Thank you for listening.